everybody, and welcome to CEP Community Live. Happy New Year. I hope that you enjoyed your little break from us. I know it's been a couple of weeks, but we're back and we're so glad that you're here. My name is Tracy Moon. I'm an occupational therapist and the Therapeutic Core Project Director for the Cognitive Empowerment Program. We are so excited to have you this week. This is a welcoming space for individuals living with mild cognitive impairment, their care partners, and the professionals who support them. At the Cognitive Empowerment Program, our mission is to help people with MCI live with confidence and clarity. Each week, we come together to learn about real-life strategies that support brain health, independence, and emotional well-being. In this series, you'll hear from experts, our staff, a lot of people from our team, on topics like memory support, nutrition, movement, mental health, and everyday living skills for those with MCI. We focus on practical, evidence-based tools that you can use to take care of your brain and your body now and into the future. Whether you're here to gain more information, find support, or simply feel more connected, you're in the right place, and we're excited to have you here. We're going to continue on this journey together, 1 week, one step at a time. CEP Community Live is part of the Harriet and Charlie Schaefer Cognitive Empowerment Program at Emory University's Goizeta Brain Health Institute. Our mission is to empower people living with cognitive changes by sharing practical, research-based lifestyle tools that are grounded not just in science, but in real-world experience. Everything we do is shaped by the voices of individuals living with mild cognitive impairment and those who support them. Together, we're building a model of care that shows how education, community, and everyday choices can help people live well today and into the future. I am excited about today's presentation. We have here with us Dr. Amy Rodriquez. She is our program director and keeps the wheels on the bus here for us. She is the mastermind behind our program in person and online. She is a research health scientist with the U.S. Department of Veteran Affairs and, again, our program director here. She's a speech-language pathologist and rehabilitation scientist whose work focuses on brain health, cognition, and recovery after neurological conditions. In our webinar today, Dr. Rodriguez will share some insights from the 2024 Lancet Commission, an international review of decades of research showing that nearly half of all dementia cases could be prevented or delayed by addressing some modifiable lifestyle and health factors, things that we can work on at any age to support our health and resilience. So Dr. Amy Rodriguez, I'm excited to hear from you, and I'm going to leave you all in good hands and hand it over.
Thank you.
You're welcome.
Well, good afternoon, everyone. It's a pleasure to be with you this afternoon and have some time to talk with you about something that is really exciting to me and to all of us in the program. So today we're going to be talking about building brain resilience and about some modifiable lifestyle factors. So I want to just begin by just talking about risk factors and what these are. A risk factor is something that can increase the chance of cognitive impairment. So there are some risk factors that can't change. So that's, for example, age and things like that. But there are some risk factors that we can change, and this is what we call modifiable risk factors. And we know that implementing healthy lifestyle habits can reduce risk and reduce the risk factors. And as Tracy already mentioned, back in 2024, the Lancet Commission on Dementia Prevention published a report that identified 14 modifiable risk factors that, if addressed, could prevent up to 45% of dementia cases, so prevent or delay dementia. And I think this is really exciting because this gives us hope. This turns, something that can be scary and, something that we feel nervous about in terms of our cognitive function and potentially facing cognitive decline. It gives us hope. It gives us hope that there are everyday things that we can do, actionable steps that we can do to change the trajectory of our brain health. So I'm really excited to walk through these modifiable risk factors with you today. And as we go into 2026, addressing these different risk factors and giving you tips and strategies for how to change just small behaviors every day that can improve your brain health. So the first is physical activity. So we know that physical inactivity is detrimental to brain health. But when we remain physically active, that increases blood flow in the brain, it reduces brain inflammation, and it supports the release of chemicals that really support different types of cognitive functioning, such as executive function and learning and memory. Exercise is really also important for reducing depression, and it helps prevent other diseases and functional decline. And importantly, it also improves sleep, and sleep is one of the other factors that is really important for brain health that we'll talk about later. So in terms of keeping our body active, there are specific recommendations that are made by the American Heart Association. And these are guidelines that we can use to guide our everyday activities. And when we think about our physical activity and what we should be aiming for, we want to get up to about 150 minutes per week of what we call moderate intensity exercise. So when you're exercising and you're kind of breathing a little bit heavier, but maybe you're still able to carry on a conversation, that type of thing. So we want to aim for about 150 minutes of that type of exercise per week, and try to spread that over at least 5 days within the week. And it doesn't have to be big, heavy bouts of exercise. This can be 15 minutes at a time even. Another important part of physical activity and exercise is muscle strength training. And the recommendation there is that you do muscle strength training at least twice per week. And really importantly, outside of keeping your body active, is just overall reducing the amount of time that you spend sitting. And this can be really challenging because, sometimes we get caught up doing things when we're in the seated position. Maybe we're working on a task or watching TV, and we can forget that we've been sitting for a long time. So strategies like, for example, using a timer that helps to remind you to stand up can be really useful. So when we think about keeping our bodies active, what I want you to keep in mind is, for some folks, these recommendations, we might not be quite there yet, but you can build up over time. You can build to achieving these goals. And you can find motivating ways for you. And the picture here on the slide talks about or shows somebody walking their dog, right? So this is a wonderful way of building just small habits into your day that can help you keep your body active. The next is keeping your mind active. So our brain loves to make new connections, right? And we know that rich learning experiences across the lifetime are really important for building cognitive reserve. And what that cognitive reserve does is it helps to delay the consequences of any brain changes that can be happening that might affect our cognition. So keeping your brain active and engaging in new learning is really important for brain health. And so what can we do? We can think about activities that promote learning and creativity. So learning a new language or maybe a new musical instrument. Learning how to do any new skill can be really helpful. Creative activities are also wonderful for the brain. So perhaps creative writing or art are great ways to keep the brain active. Puzzles and games are another wonderful way to keep your brain engaged. So I like to do the New York Times puzzles, and there's a lot of wonderful little short puzzles that you can do within sometimes even a few minutes that just gives your brain a little bit of extra challenge within the day. And then reading is another way to keep your mind active. And so these are just some suggestions, and throughout the year we'll be talking about some of these other types of cognitive activities that can really support brain health. Next, really important, is staying socially connected. And we are so glad you're here. A lot of you have been part of our community for a long time now. And we know that connection with each other and with a community is so important. It's not only just important for making us feel good and adding to our quality of life, but it actually does change your brain. So people who are more socially connected have greater brain volume and better connectivity across brain regions, which impacts how your brain functions. And so staying socially connected is a really important part of brain health. We know that it promotes meaning, purpose, and well-being, and all of those are wonderful things for feeling empowered and feeling like your life has purpose. So spend time with friends, spend time with family, connect with your community. Even volunteering for causes that are important to you are great ways to remain socially connected. The next is managing depression. So depression and stress can be really difficult on your health, your behavior, and also your brain. And it can also get in the way sometimes of doing other things that are modifiable risk factors. So when we're experiencing a lot of depression and stress, for example, sometimes it makes us, less likely to socially connect with others. And so managing depression is important in and of itself, but also helps to promote some of the other activities that are really important for brain health. So some of the things that can help to, reduce depression and kind of bring us to a different headspace are humor. So finding the humor in life, trying to find the humor even in the small things can be important. Mindfulness and deep breathing is really important for bringing our awareness to the moment rather than, worrying about things in the past or looking to the future and worrying about things that may happen as we progress. So mindfulness and deep breathing are some things that we'll talk about a lot this year as well. Other things include listening to music, spending time outdoors, and then asking others for support. So a lot of these modifiable risk factors, if you haven't been doing some of these things or if you struggle with them, it is always encouraged to ask people, ask your friends, ask your family members, ask your doctor for the support you need, because there are strategies out there and there are things that can help you get to the place that you want to be. The next is protecting your senses. And what I'm talking about here is your hearing and your vision. And so we know that when we're experiencing any sort of hearing or vision loss, that can limit our participation. So for example, if it's really hard to hear, sometimes we just kind of hang back because we're not following the conversation. Then over time, that can have an impact on the way that we socialize with others, but also the way that we use our brains. And our brains is kind of like a muscle. You need to use it for it to stay strong. And so if we're not using our brains or if we're overloading it because our senses are kind of failing, then that can have a negative impact. And, especially for people who are aging, who may be experiencing both hearing and some vision loss, that can further increase the risk. So the recommendations here are really to get regular checkups of your hearing and your vision. If your doctor has prescribed glasses or hearing aids, use those so that you can remain engaged and you can keep your brain engaged as well. The next one we'll talk about is head injuries. So preventing head injuries is really important. And we know that head injuries themselves can have a negative impact on the way that our brain functions. But even over time, head injuries can cause the buildup of proteins that can damage brain cells. So thinking about the ways that you can keep yourself safe is really important. So if you're enjoying things like bike riding, remembering to wear a helmet is important. And if you're driving, remember to wear your seatbelt in case of an accident to keep you as safe as possible. In our homes is another place where, we have some risks around head injury. So fall proofing your home is a really important part of that. So we think about, keeping our spaces and our floors free of obstacles and things that might be trip hazards like cords or rugs. And we have really wonderful programming around home and personal safety that will talk about all of these things in terms of fall proofing your home and strategies for you to remain really safe. And then finally, maintaining strength and balance, and especially dynamic balance, is a really important part of preventing head injuries. So as we age, the risk of falling increases. And you might have noticed that, if you trip, it becomes a little bit more difficult to kind of remain upright and kind of, avoid falling. And so an important part of being able to do that is really having the strength and balance to prevent that fall. And so again, when we think about, all of the different modifiable risk factors and physical activity and strength training being part of that, that's really going to also help potentially with preventing head injuries. And then finally, reducing exposure to pollution. So this is one of the factors that was added since a previous report. And what we're beginning to understand is that air pollution is something that increases inflammation in the brain and is also linked to other medical risk factors. And so limiting outdoor activities when the pollution levels are high, and even using air purification and ventilation indoors can just, help to support a good air quality and protect your brain. Now, we know there are a number of cardiovascular risk factors that may impact the brain. So there is a really strong, what we call cardiovascular cognition connection. So the way that, what's good for your heart is good for your brain, and the opposite is also true. And so things that affect your heart can affect your brain. And conditions like high blood pressure, high cholesterol, diabetes, those all have potentially negative effects that can include damaging your blood vessels, reducing blood flow, and increasing inflammation in the brain. Other things like obesity, excessive alcohol consumption, and nicotine use can also be damaging to the brain. So when we think about these specific risk factors, what we want to think about is protecting our heart so we can protect our brain. And the recommendations here, of course, include getting regular checkups, knowing your numbers, for example, and then monitoring your blood pressure, your cholesterol levels, and your blood sugar so that you can be on top of these different potential conditions that might affect your brain. And if your doctor prescribes medications to help control your blood pressure or your cholesterol or your blood sugar, taking those as prescribed is really important. In terms of alcohol, we want to limit alcohol to no more than 2 drinks per day. Avoiding, smoking or vaping is also really important for brain health. And then finally, maintaining a healthy weight. And for everybody, that looks a little bit different. So you'll want to consult with your doctor about what that looks like. And then kind of managing and, keeping track of your weight can be important. And part of that will lead into the next slide is following a brain healthy diet. So the next thing we'll talk about is following the MIND diet. So the MIND diet, and some of you may be familiar and some of you may not, is a combination between the Mediterranean and the DASH diet. And there are specific foods that are recommended and specific foods that we should avoid as part of the MIND diet, which I'll talk about on the next slide. But there's mounting evidence that if people follow the MIND diet, that decreases inflammation in the brain and other risk factors for dementia. So being really strict with MIND diet can reduce risk by up to 53%. And even moderate adherence, so following most of the recommendations most of the time, can reduce risk by about 35%. So when we think about changing our diet, sometimes that can feel like a big thing, but we want to think about the small changes we can make and make consistently over time that can make a big difference. In terms of the MIND diet recommendations, I mentioned there are some foods to enjoy and some foods to avoid. So things that we can enjoy are leafy greens, whole grains, berries, nuts and seeds, beans, lean proteins, and healthy fat. And our nutrition sessions over the next year in CEP Live will dig a lot deeper into each of these things that we should be eating to promote brain health. Things to avoid include red and processed meats, saturated fats, refined grains, added sugar, and ultra-processed foods. And so some of you might be thinking, well, that sounds like a lot of things I like to enjoy. So remember that when we're talking about diet changes, these are small changes, and there are really wonderful ways to and strategies that you can use that will help teach you about making these small changes that are really important. And finally, getting better sleep. So sleep is an activity that is really important for brain health. And so, I can speak for myself, and I'm sure many of you have had an experience where when you sleep, the next day you don't feel quite yourself. Maybe you can't think like you normally do. Maybe, you kind of become a little bit more on edge, things like that. And that's because some really important things happen when you sleep. Sleep is important for, creating memories, for restoring our energy, and for clearing out toxins in our brain, and also for emotional regulation. So really focusing and being intentional about getting better sleep is an important part of brain health. We'll talk about that again, but some of the things you can begin to think about are maintaining a consistent sleep routine. And that means going to bed and waking up around the same time each day so that your body gets into a rhythm and a habit of sleep. And then things that we call sleep hygiene, so avoiding caffeine in the afternoon and avoiding screen time an hour before bedtime can prepare your brain for sleep. And then some of the other things to avoid a couple hours before bed would be exercise, nicotine, alcohol, and heavy meals. This will prepare your brain for sleep. And if you are one of those people who, lays down and your mind just continues to race and your thoughts kind of continue, you can also think about meditation or deep breathing or other things that may ready you for sleep. So in terms of sleeping, what we really want to think about is aiming at least 7 hours per night. And again, creating a routine and using these different sleep hygiene strategies may help you achieve that. And if you're having trouble still achieving 7 hours of sleep, it's also something that you can talk to your doctor about. So a few recaps and takeaways then from what we've talked about today. These modifiable risk factors are really everyday choices. They represent things that we can think about on a daily basis, that we can be intentional about, that can really change our brain health. And sometimes it feels like well, there's nothing I can do, right? I'm already experiencing some of these, or I have a diagnosis of mild cognitive impairment. It feels like there aren't things that I can do. And what I want to impart, and what we do here at CEP and within our community, is really say there are things that you can do. You can be empowered. You can take steps that do make a difference, and we will help share those actionable steps with you. Remember that small, consistent habits can make a difference, and even those small changes have a cumulative effect. So doing more physical exercise will help your sleep, and that may help you reduce depression and help you more likely to socially engage. So all of these changes accumulate and really help to reduce your risk. Remember that you don't have to go it alone. Medications and supportive strategies are available. We have a community here who's going to help you all through the year with those strategies. Talk about these things with your family. You might have noticed on the slide where I showed the 14 modifiable risk factors. These are all throughout your lifetime. So it's, people should start this as early as possible. And so even talking with, your children and your grandchildren, and finding ways to engage with them will be really important for supporting any changes that you want to make, and will be helpful for them in their brain health journey as well. And then finally, just start as soon as you can, and remember that it's never too late. Our brain is changing all the time in response to experience, that is experience-dependent neuroplasticity, right? And the more positive experiences we give our brain, the more our brain responds to that. And so even if you haven't been doing some of these things and you're curious about them and you want to try them, it's not too late. Be encouraged, and be hopeful that these are actionable steps that you can take. And so in wrapping up, I just want to say welcome to CEP Community Live in this year of 2026. Again, we are so glad you're here. We're really excited about having themes throughout the year that dive into these different modifiable risk factors, and we look forward to better brain health together. Thank you.
Thank you so much for talking with us today, Amy. I love that there is hope. I feel like everything that we hear about cognitive impairment and Alzheimer's and dementia is so unhopeful. And I just feel like this talk lets people know that there are tangible things that they can do every day. So thank you for sharing this with us. We are really excited about 2026 with CEP Live. Amy's idea for this presentation was to give you a look at all 14 modifiable risk factors, and then we as a team are going to kind of dive into those throughout the year. So all of 2026 is kind of framed around these ideas, and our hope to give you tangible action items throughout the entire year. We do have a couple of questions here in the chat that I'm going to ask. The first one that we got is, if I'm worried about my balance, what should I do to help with that?
So that's a really important question, and I think that throughout the year we will be addressing that through our physical activity sessions. But I would recommend, for example, finding some videos maybe from our past sessions that talk about balance, and finding ways to safely practice balance. So I know that Ayatoni and Mark talk about using supports when you're working on your balance so that you can do that safely, and really thinking about maintaining balance as kind of like a static thing, but dynamic balance as well. So moving over obstacles and things like that kind of more mimic what happens when you're moving your body and sometimes become off balance. So I think that there are some supports that we have with our programming that we will do this year, and that the recorded content that we have online as well. But if you're worried about balance, you can also talk to your doctor. Referrals to physical therapy, for example, may be helpful to keep you safe.
Yeah, absolutely. The next one is, with brain injury, what types of damage do you typically see with a brain injury? So
the type of things that you can see with brain injury really depends on where the damage happens and the type of damage that you have. And so head injuries, depending on whether that's a fall and you kind of have a focal injury, or it's something that's a little bit more dynamic and causes more diffuse injury across the brain, it can really kind of vary. So it's a little bit hard to to answer that question specifically, but it depends on the type of injury and where it happens in the brain. But the thing about our brains is that even with what we call a focal injury, like we often get with a head injury, that area that's damaged is connected to other areas in the brain. And so what can happen is, if there is a disconnection because of that damage, then it impacts the way that the brain functions and other things that you're doing. And that's why even beyond just the damage that happens in that focal area, it can impact brain function, because it's more what we call a diffuse kind of impact.
Yeah, that's a good way to put it, and good to know. During sleep, our brain detoxes. If you're only getting less than an hour of deep sleep, is that problematic? And how much sleep do you typically recommend?
So we would, the recommendations are, like we mentioned, about 7 hours of sleep. There are different stages of sleep, and as was kind of alluded to in the question, and these things that happen during sleep, like memory consolidation and clearing toxins and emotional regulation, those do happen in different stages of sleep. And so that's where getting into each of those stages of sleep within that 7 hour cycle, or the cycle that you go through in sleep, is really important. And so if you find that you're not getting enough sleep, then I would recommend the strategies or talking to your doctor, because there are some things that can impact our sleep even outside of, there are medical conditions like sleep apnea that can get in the way of getting adequate sleep, and that may need to be managed medically. So the recommendation there would be, if the behavioral strategies don't work, to talk with your doctor about other ways that you might get support for sleep.
Perfect. And we have one more question about activity. Is there such thing as too much activity, or is there a sweet spot that we should be aiming for?
So that's a good question. Is there such a thing as too much activity? I would say listen to your body. We don't want to become exhausted and kind of overwork ourselves. And so if you're meeting the recommendations that are put forth and that we talked about in the slides, of the type of physical activity and the strength training that you should get each week, then I think that's a safe target. If you want to do more, and that isn't draining you or causing pain or other things that can be disruptive, then more is probably okay. But I would say that it's important to listen to your body, and making sure that the level of activity that you're engaging in isn't having any harmful side effects.
Yeah, that's perfect. So like we mentioned, that's all the questions that I see for right now. Like we mentioned, we're going to be diving into all of these factors throughout the whole year, so I hope that you guys will continue to stay tuned in with us. We have a lot of you on today, and we're excited that you joined us at the beginning of the year. I know it's not always easy to be productive this week, but I hope that you guys continue to log in throughout 2026 to learn more and dive a little bit deeper. And thank you again, Dr. Rodriquez, for joining us and providing this education. We got a ton of feedback about how great this was. Somebody is ready to start the Mind Diet tomorrow, and
I love it.
Fully encourage that. Yeah, we're here. It's 2026, and we're setting new goals for better brain health this year. So thank you guys for hanging out with us, and we will see you next week to talk about getting active and how physical activity can support our brain health.